When considering upper eyelid blepharoplasty, one of the most common questions I have is, are you going to use dissolving or non-dissolving sutures? Now, there's no real right answer, and there are benefits and pros and cons to each one of them. And here, watching this video, hopefully we'll be able to give you some more information so that you can understand more as to what suture is being used for you and why. My name's Ahmed Aziz, and I'm an oculoplastic surgeon in London. So this is something that plays on many patients' minds, and what we're going to go through now are first the dissolving sutures and then the non-dissolving sutures. Some of the most common dissolving sutures are Vicryl and Monocryl, and some of the most common non-dissolving sutures are Prolene and Nylon, and we'll be discussing those now. Dissolving sutures are really convenient because they disappear on their own, and as a result there's no need for that follow-up to remove them or that uncomfortable feeling of having sutures taken out from your eyelids. For me, the disadvantage of having dissolving sutures is that when they are disappearing, they're breaking down within the skin, they tend to stay there for a bit longer, and as a result you're having suture material staying within the eyelid for a bit longer. Other people can sometimes react to that suture material, and if they're reacting to that suture material, they still need to be taken out anyway. There really isn't much difference between the dissolving or non-dissolving sutures, but in theory, I just like the idea of having a non-dissolving suture that you can then take out at 1 week, and then you'll make sure that all that material is gone. And because with blepharoplasty, it's eyelid surgery and the scar is on the face, I want that scar to be as perfect as possible and reduce the risks, even if they're super minimal. As you've guessed it, the non-dissolving sutures, they do require removal, and that's their main disadvantage, and people don't like the idea of having those stitches taken out if they can avoid it. That they can provide a secure, more longer lasting hold because they're not breaking down, they're staying as they are. And then once we've taken them away, we then know that all that suture material is gone, and as a result you're probably having suture material in contact with your skin for a smaller period of time, because even the ones that do dissolve start to break down over 5 days or 8 weeks, depending on what type of suture material is used. But that's when they start to break down. It doesn't mean they're all gone in that day. It means that they are then starting that process, and that process can take a few days to a few weeks. Now, despite my personal preference for non-dissolving sutures, when you look at the evidence, there is really no difference between using dissolving and non-dissolving sutures. So when you look at studies and you're looking at the scar in both patients, they tend to have very similar scarring. And so I think this is really down to personal factors like, the advice of your surgeon, and also things like you and your personal preference. So if I have a patient who really wants dissolving sutures, I will offer them dissolving sutures. If I have somebody who's coming from abroad and needs to travel, then maybe I'll give them also dissolving sutures because they may not have that time to come back for that follow-up appointment. If somebody is really against the idea, they really cannot bear having stitches taken out of the eyelid, then I'll probably use those dissolving sutures as well. So it really boils down to a number of things. My default is the non-dissolving that I take out a week later, but everyone has to be a bit flexible, and we have to incorporate that person's needs and discuss these things with your surgeon and raise your concerns if you have any that might affect the choice. Remember, each option does have its pros and its cons. There is no one answer to this, and discussing this with your doctor is the best way to find out what's best for you. The other thing that you can talk about in sutures is monofilament or braided sutures. Now, the monofilament means that it is one filament, so there is one suture material. And a braided suture is a bit like a shoelace, and you can find that there are multiple smaller strands, or like a rope. There's multiple strands there. Now, the multiple strands are really useful in terms of suture tying and maneuverability, but they increase the surface area, and they provide little nooks where bacteria could potentially grow. The monofilament is a bit more difficult to handle, but because it's one monofilament, the surface area is reduced, and as a result the infection rate is theoretically smaller, and that's why I tend to like the non-dissolving monofilament, and I try and avoid the multifilament or the braided sutures. And the Vicryl suture that is used tends to be a braided suture. There is a dissolvable monofilament, and that's called Monocryl, that some people do also use. Good. So